called delusional parasitosis. And it is basically a psychiatric diagnosis. It is a delusional disorder that someone believes strongly that they are infected with some sort of infectious species, typically a parasite, but also bugs or bacteria or something else. And it is one of the toughest patient encounters that I've ever had, and I've had a few. I'm sure it's more commonly seen amongst family practice physicians and other providers or PCPs, and also dermatologists, because it's commonly patients presenting with some sort of skin problem where they believe that there's bugs or some other infection there. And all the convincing, all the proof, all the testing completed cannot convince these individuals that they are not infected. It is an exhausting situation, both for the person affected. Imagine living a life where you constantly think that you have some sort of parasite or life-threatening infection of sorts, and doctors are telling you, no, you don't. It's really, really, really tough. And it cannot get better by telling the person you don't have this. And it is really hard because the treatment for it is psychiatric management, which is also a challenge for a psychiatrist to treat it. And the encounters that I've had are typically very long office appointments with follow-up stool tests and other tests that we may do, sometimes even going so far as a colonoscopy or endoscopy to show that they don't have some sort of parasite or other concern. And when those tests are negative, the person feels like I'm lying to them. They don't trust my results in any way, and it is almost impossible to convince them otherwise. I've had patients bring in a container of their stool to show me, and they're pointing out, see those little things that are moving? And I'm trying to explain to them, I don't see that. And, trying to be as calm and as validating to what their concerns are, but also speaking truthfully that, I can't confirm what your concern is. I've had patients film their stool. They had a bowel movement on a flat surface and then filmed that stool, convinced that they see something moving or wiggling in there. And they're showing me this. And again, I'm saying, I don't see that. And it's really tough because I have to be very careful that I'm, one, validating what their concerns are, because I never want anyone to feel that I'm, quote, gaslighting them and what their concerns are. But also, there's only so many times that I can repeat certain tests before it becomes unhelpful for everyone involved. So if you know someone with this condition, or if you are a physician or provider, I would love to hear, your history with those and any tips on how to manage those, because they are certainly some of the saddest situations, not being able to provide any help or validation or a reassurance that they're not infected, because indeed they simply don't want to believe me. So any input or stories would be really helpful. Thanks.